see. All right, so the reason that we are gathered here this morning is that, I've sent out a lot of messages about the how of getting a vaccine, but I thought it was also good for all of us to get together to talk about the why, like why this is important for us and for our community. And Skip Williams, who you will meet in a second, is our board president. So some of you know him, some of you don't, but he's, familiar with many of us, and obviously very familiar with the work of Food and Friends. And he's got a really great history that I think makes him a good person to be talking to us about the vaccine. He has run a hospital. He was the president of the SUNY Downstate Medical Center in New York City. He has run a medical school. He was the dean of GW Medical School. He's also been a clinician. And so he's been, just an educator and a mentor and a teacher for much of his life and his career. So I think he's a really good person to talk to us about what he knows about the vaccines. So if you will continue to bear with us for just a minute, and we'll try to get him on. I'm sorry about the hold up.
I'm on.
Oh, you're on.
I'm on.
Hello, Skip.
I had to go over to the other. I had to go over to the other computer.
Yeah. Okay. Sorry about that. So you probably missed my intro, but I was just letting folks know who you are. About your history with GW and SUNY Downstate, and just as an educator, and just your care and commitment to Food and Friends. As a number of reasons why I think you're a great person to talk to us about vaccinations today. So what we're going to do is, we're going to allow Skip to share some of his wisdom with us. And then we've got some questions. Dalton has some questions that we've already sort of collected and put together from what folks have been talking about. We'll share those, and Skip can speak to those. And then if you have any other questions, you're welcome to ask those. If we've got time at the end. The one thing that I ask, which, probably makes sense, is just don't ask any question about your specific health, right? Like, I have X health condition, can I get the vaccine? As long as you don't do that, you can ask anything that you want if you still have questions. So Skip, I will turn it over to you.
Okay, thank you very much, and good morning to everyone. And I just wanted to let everyone know that I am extremely happy because I got my second dose of the Moderna vaccine on Tuesday. And except for a tiny bit of a sore arm, I am absolutely fine and looking forward to speaking with all of you. I'm only going to take a few minutes and try and put things into perspective for you, because the biggest question I get is, why should I get vaccinated? And the very simple answer is because it saves lives. It may not save your life specifically, but someone else who gets the vaccine may save your life because they're not spreading the disease and you're not spreading it to someone else. So that's the number one reason. The second question I get asked all the time, is it working? Even in this very early stage, we have seen a decrease in nursing homes of over 80%. That's 80% in infections. And if you look worldwide at other countries who have been administering this vaccine, they've seen a similar decrease in infections. So everyone should get this infection. Let me put things in perspective for you a little bit. First of all, when we talk about the SARS coronavirus, coronavirus has been around for a long time. The United States and the rest of the world discovered it probably in the 1960s. It's responsible for many of the flus we see and many of the common viral infectious diseases that we see yearly. So it's been around and it's not going anywhere. The difference with SARS, and what SARS stands for, is severe acute respiratory syndrome. The big difference with SARS is that where the other coronaviruses would not kill you, or if you were severely debilitated, it might make you very sick and you could die. SARS will kill you because it attacks the respiratory system and it prevents you from breathing. The other question I get all the time is, well, did they rush to get these vaccines out? And the answer is no. I can tell you from personal experience on my floor at GW Medical Center, where we had laboratories, we've been working on these techniques for over a decade, at least since 2002, 2003, the latest, that we have been looking at these techniques. And what basically happened is under President Trump, he asked these companies to come together, to work together, to share information, which had never, ever been done before. So I do credit him with that. And as a result of that, we now have at least 3 companies in the United States, and there's one in Russia, there's one currently in China, that have all come up with vaccines. And this is what happens when you have a coordinated approach to a problem. And we saw that towards the very end with the AIDS drugs as well, that finally scientists and laboratories started working together. They got their egos out of it, and they were able to come up with some at least therapeutics in the AIDS. Let's talk a second about the different vaccines. There's the Moderna, as you know, the Pfizer, and the J&J, and I'm going to spend a little time on the J&J. First of all, let me say that all of them are highly, highly effective, okay? And all of them are highly, highly safe. Worldwide, there have just been a handful of people who have had allergic or bad reactions. We're talking in the United States alone, we've given 5 million doses. And I think we've had either 3 or 4 people who have had reactions. Now, the papers sensationalize when this happens. You hear about somebody that had the vaccine on one day and they died 2 days later. 9 times out of 10, it had absolutely nothing to do with the vaccine itself. The difference with the Moderna and the Pfizer is they're a 2-shot vaccine, and you have to keep them at extremely low temperatures. And just very recently, this weekend, the J&J vaccine came out. And what I want people to understand about the J&J vaccine, it's just as safe and just as effective as the Moderna and the Pfizer. When you start listening to people compare these vaccines, just remember that what they're talking about is all 3 vaccines. No one in their trials, no one has gotten so sick that they had to be hospitalized, and no one, 0, have died. All 3. The difference between Moderna, Pfizer, and J&J is Moderna and Pfizer, they seem to be a little bit more effective when it comes to mild disease. That's it. I would take the J&J vaccine this moment. If I hadn't been vaccinated and it was offered to me, I would take it this moment. The other thing to remember is that there were very, very stringent testing that had to be done for these vaccines to be approved. They were tightly controlled. And what's really important for all of you who work, it was a very, very diverse population that these vaccines were tested on. Each one of them had a minimum of 10% African Americans, 10% Latinos and Asian Americans. And some of them had as much as 20+ % of these minority populations. Now, I know there's been a significant amount of vaccine hesitancy in the country, and for good reason. The United States has not had a good track record by using people of color for experimentation and so forth. The difference now, and I can say this with a surety, is that the National Medical Association, which is the Black equivalent of the American Medical Association, they met with every single vaccine company before the vaccines came out. And they went over how they conducted, who the folks were that were volunteering, and they gave their gold seal of approval. They said that there are no shenanigans, that these are straight up, that there is no experimentation going on. This is all about being safe and being effective. Now, people ask me also about the side effects. All right, the biggest side effect is soreness at the injection site. Occasionally, there are some aches, some slight nausea, and these are all gone in 48 hours or less. Most people say in less than 24 hours. No one has gotten acutely ill that they had to be put into a hospital as a result of the vaccines. So the vaccines are extremely safe. And I can say on a personal note that on Biden's task force, 2 of my former students sit on the Biden task force. One is Black and the other is Hispanic. And so they are looking at all of this data very, very closely, and they give their grand seal of approval. The other question I get is, which one is the best one? The best one is the one that's in your arm, according to Dr. Fauci, and I agree with that 100%. I would take any one of them. I would not hesitate. I would not hesitate to have any family member of mine take any one of these vaccines as well. So, big question. Well, what can I do once I'm vaccinated? Do I have to wear a mask? Can I be around other people? Right now, because the vaccines were only tested for about a year, we don't know for sure whether you can transmit if you are an asymptomatic carrier, okay? The good news is the J&J vaccine, there is sufficient evidence to say that if you have that vaccine, no, you can't transmit, at least at a high level. We suspect, because we see it in other countries already, that with the other 2 vaccines as well, that you won't pass the virus on to anyone else. So if you and your small cluster of friends or family members have been vaccinated, you can get together. You can be without a mask. The reason we're wearing masks, again, is because we're not 100% about transmission. And therefore, again, masks also save lives. But you can get together for small dinners. People in your bubble, for sure. If everybody's been vaccinated, you don't have to wear your masks. But if you go out in public, we ask you to please, please wear your mask. So, Carrie, that's what I have to report. I wanted to keep it short because I wanted to make sure people had questions. And if I don't know the answer, I promise you, I will talk to the experts and I will get you the answer to your questions.
There you go.
Thank you all.
You know the experts, that's for sure. And you are an expert. So thank you, Skip, for sharing all of that. I really appreciate it. And, you know, we know how much you care about us, how much you care about Food and Friends. And so I really appreciate your taking the time to spend with us this morning. So I think in regards to the questions that we had queued up, I actually think you've already spoken to some of those. You know, we, in regards to sort of what you can do after you're vaccinated and in regards to the different vaccines. So that's fantastic. So given that, I want to open it up to anybody else. If you have any questions at all about, you know, the vaccine or anything related to it, that Skip can speak to, because we've got a little bit more time together. So please do chime in if you have a question.
Don't be shy. Well, did you guys feel I answered your questions?
Good. I'm seeing a lot of head nods. That's fantastic. If you do think of something later, you know.
I have a question.
Oh, good, great.
I have a question. Hi, Skip. Thank you so much for sharing your time and expertise with us. My name is Katrina, and I'm going to need you to help me with this question. I know what I'm trying to say, but I don't know how to fully articulate it.
Sure.
Okay. Has there been a time, I guess, in modern history that you know of, and I think it may have been polio, but I'm not sure, where there was a limited buildup like this one, or a limited time trial, and then people were vaccinated? I'm
No,
interested
I
in
know what
that
you're
time.
getting at. You're
Okay.
absolutely right. With the original polio tests, because there hadn't been long established clinical trials, they rushed it. And as a result, people were injured. And I think that scientists learned a great lesson from that you couldn't rush it. And that's why I'm telling you, the way these vaccines have been developed, they were not rushed. These are techniques that our scientists have been practicing for at least a decade. And they followed those strict protocols. The difference, and you ask a great question, by the way, Katrina, the difference is that they were able to do some of the things in parallel. Instead of waiting till one step was completely over, then start another step and another step. They were able to do it in parallel. And if they saw something that wasn't working right, they pulled back. Okay. And that was the big difference. But you're completely accurate and right on about the polio vaccine.
Okay, thank you so much.
And they eventually got it right.
Okay, thank you. That was helpful.
Yep, I have a question. This is Marilyn. Yes. I was just curious what your thoughts are. I know they're starting to talk that we're going to need a booster or an annual shot, or like the flu shot for this moving forward. Any thoughts on that?
Yeah, it is very, very possible. I think with the J&J vaccine, we won't. J&J was the only one that tested in Brazil and South Africa. And they found out that they had efficacy in both of those variants. The other two were not tested for the variants. So there is a possibility that you'll need a booster. So just like the flu shot every year they get the data of what variants are out there, and then they put a flu vaccine together. And again, because this is a coronavirus, it's going to change. This is what viruses do. And the reason why it's so important to vaccinate everybody or as many people as possible, because they can't create variants if you have immunity. The longer you go without immunity, the more the virus can change. So to answer your question directly, there's a good chance you'll need a booster in the future, maybe not right away. The good news is Pfizer and Moderna are working on a booster right now.
Thank you.
Other questions? Thank you for the question, Marilyn. Katrina?
Yeah, thank you. So from a clinical perspective, when you go to a Kaiser or whatever center is providing the vaccinations, do they just simply choose? Will they have Pfizer and Moderna and J&J and they choose for you? Or does a place just have one type of vaccine and that's what you get?
They generally just have one type. And it's all because of the limited number of doses and distribution. There have been one or two centers that have gotten more than one in small numbers, and they've asked patients, which one do you want?
Oh, okay.
And and honest to God, I wouldn't care which one. I would not care. just give me the shot.
Okay, thank you.
Great. All right. I actually have one clarifying question for you, Skip. You were talking about how coronaviruses have been with us for a long time, right? So my understanding is, obviously this is a new one and it's never been in the human population before, and that's part of why it's been so devastating. But some of that knowledge from prior coronaviruses that were different were what led to, some of the knowledge that scientists already had about the vaccine. Is that correct?
Correct.
Okay, great.
It is
I just
true.
wanted to make sure
Again, the coronaviruses are ubiquitous, and we didn't recognize the link between animals and humans until the 1960s, where the viruses made the leap. So generally, you remember we used to have pig flu and bird flu, and then all of a sudden it became H5N1, okay? And that meant that now you had a vector that was in an animal and it spread to a human being. Did this happen with COVID-19? And by the way, COVID-19 stands for, coronavirus, and 19 is the year that it was discovered, 2019. Did it come from an animal? Everybody thought it came from that open air market in China. Well, nobody's quite sure yet. The only thing they're pretty sure about is that it was not manufactured. It did not come from a laboratory. It either came from animals or, somebody on a farm got it, came into the market and spread it that way.
Great.
But they're around, they're ubiquitous, and this is going to be with us. And we have to develop immunity just like we do with the flu.
Great. We've got about 5 more minutes. Does anybody else want to ask one more question for Skip while we have him? Yes, Becca.
I have, this is kind of a general question for sort of the population in general. I know.
I'm sorry, who's this?
Oh, I'm sorry. My name is Becca. I'm one of the dietitians. Hello.
Okay, hi, Becca.
I know with the flu vaccine, there have been issues with folks who have allergies to, let's say, egg because it's in like an egg solution. And I haven't really heard much about that with this vaccine and people who have allergies to eggs. Is it not in that kind of solution, or people not having the same reaction?
That's a great question. I'm pretty sure it's not, but I don't know the answer to that, so I'll find out for you. I know the only allergic reaction so far they've been able to pin down is some of the solvents and things that they use to make the virus. I want everyone to know that there is no live virus that's being injected in you. There's no live virus. What they've done is they've taken particles and they've gotten a protein reaction to those particles, but there's no virus being injected in you. But I'll find out the answer for that, whether it's in an egg broth. I'm almost 100% sure it's not, but I'll find out.
Thanks.
I will say, I got my first shot last week, and they did not ask me that question on the form the way that they do every year when we have the flu shot clinic here, and they specifically ask you that egg question. So I think that is likely the answer, but thank you, Skip, for confirming that. I appreciate it. Okay. Looking for hands. Anybody else? Going, gone. Okay. Well, thank you all for, for taking the time out of your morning. I know this is when, we're generally really busy in the mornings, but I thought this was really important just for us to have a conversation together with some expert advice from someone who's very near and dear to Food and Friends. So thank you so much to Skip for today, for everything you do for us as board president. But this was really, really great for you to take the time to talk with us today. So thank you.
My pleasure. And I'm hoping in the not too distant future, I can actually meet people face to face.
Indeed. That would be a
Okay.
wonderful day.
All right. Have a great day, everybody.
Take
Thanks
care.
so much.
Thanks, Skip.